Good afternoon, everyone. My name is Yann Sakref. I am a postdoctoral scholar under the supervision of Dr. Lisa Knowlton. Thank you for the opportunity to present our research today entitled Seeing the Invisible, Enhancing Intraoperative Vision with SWIR-V. Quick disclosure regarding our funding. Another disclosure not written here is that I am a PhD in physics and not a medical doctor. But this allows me to give you the perspective of a patient, and I am a little worried by the number of intraoperative iatrogenic nerve injuries occurring every year in the US. It concerns 500,000 patients annually with symptoms ranging from pain to reduced quality of life to complete loss of some motor function. Why do these injuries occur? Because prevention relies primarily on direct visualization of nerves, and this is challenging. Nerves have small size, they lack distinguishing features, they can be obscured by fatty tissue or blood in the operative field, and it's particularly challenging for non-native anatomy in presence of tumor, inflammation, or scar tissue for redo surgery. Techniques have been made to navigate the surgical scene and identify nerves, one of the most common being intraoperative nerve monitoring. These techniques detect EMG signals from muscles innervated by target nerve. The problem with this is that it disrupts the dissection workflow. It can lead to false positive and false negative, which kind of defeat the purpose of using this device in the first place. Other techniques are high-frequency ultrasound, which is limited to superficial nerves due to shallow penetration depth, or fluorescence-based imaging, which actually lacks nerve specificity. And so to enhance intraoperative vision, we are studying SWIR. SWIR is a band of light within the infrared spectrum. It's spanned from 1,000 to 2,000 nanometer. And it stands for Shortwave infrared. We add the V for visualization. What makes SWIR-V so interesting is that water, lipid, and collagen, which are essential molecules in the body, have characteristic absorptions within this range. So here, this is the absorption of a different molecule as a function of the wavelength. And what I'm asking you to pay attention to is that water, lipid, and collagen, respectively in blue, green, and pink, have characteristic absorptions after 1,000 nanometer in a SWIR-V range, but before that, they're all collapsed, and it's difficult to distinguish one from another. So we aim to develop a non-invasive, dye-free intraoperative tool using SWIR-V to augment the visualization and aid in protecting critical anatomical structures. We first focus on nerve visualization with preclinical studies in animal cadaver rat and porcine models. To characterize SWIR-V in rat and porcine model, we visualize the nerves at various SWIR wavelengths. And so far, we have studied 10 rats model, mostly focusing on the sciatic nerve, and 15 porcine models looking at the recurrent laryngeal, facial, intercostal, and cutaneous nerve. The images we obtain are reviewed collaboratively by a team of engineers and surgeons. The first exciting result we obtain is the improved nerve contrast against surrounding tissue. So what I'm showing to you here is a picture of a rat sciatic nerve at different SWIR wavelengths. And what I'm asking you to pay attention to is the difference in contrast between those different wavelengths, between the nerve in the middle and the surrounding tissue around. We scanned multiple wavelengths like these to find the ones that would optimize the contrast. Our assumption, what we anticipated is that some wavelength would absorb water very well. And so for these wavelengths, the surrounding tissue that is water rich would appear darker than the comparatively low water poor nerves. And we can quantify that by plotting here. I'm not using the, okay, by plotting here on the y-axis the absorption as a function of where we are in a picture on the x-axis. And in an ideal scenario, what we expect to obtain is a bell-shaped curve or spike, where the tissue absorbs a lot of the SWIR-V, whereas the surrounding nerve, the nerve does not. And we can quantify this spike by something called the Weber contrast. And here we obtain at some wavelength a Weber contrast of 2. The Weber contrast of white light is 0.5. So here we have 4 times more contrast than with white light. So here's an illustration of what this looks like on trachea of a pig. On the left, what you're seeing is a surgeon in a team showing you where the recurrent laryngeal nerve is on this trachea. And obviously, it's super hard to see because the contrast is so low. On the right side, however, what you see is the SWIR imaging. And the nerve appears running along the trachea, and it's very obvious where it is. And what makes this image also so appealing is that the vessel below it appears in a different color. And so it's very easy to tell the difference between those nerves and the vessels, which is very important for some surgical cases. Another exciting result is that we can visualize nerve-specific features that are called the bands of Fontana. These are irregular, dark, and light strip, and they are due to the wavy disposition of the nerve fibers inside the nerves. Observing those bands of Fontana allow us to confidently identify peripheral nerves. Lastly, to improve the visualization, we are incorporating AI computer vision models for delineating those nerves on a SWIR-V video streaming. So here what you're seeing on the left is the native SWIR video, and on the right, this is the one where we use computer vision algorithm to delineate the nerve. Our long-term goal is to incorporate these vision models in real time and to fine-tune them on the SWIR wavelength. Importantly, this is the technology side, but what makes us so exciting is to bring this technology to the OR, to the surgeons. And so something we think a lot about is how do we tailor SWIR-V to surgeons' need. Typical example is what should be the form factor? How do we deliver SWIR-V? Through a robotic arm, through a surgical microscope, a hand device, or loops? To determine that, we do qualitative stakeholder interview to validate the highest yield intraoperative visualization need, as well as biodesign iteration and prototype usability and applicability across various surgical approaches. In conclusion, the enhanced contrast and bands of Fontana serve as distinct sources to identify the nerves in real time, and SWIR provide a promising non-invasive level-free method to reduce iatrogenic nerve injuries. We are currently optimizing SWIR applications across various tissue types and depth, as well as testing in live porcine model and human cadaver in the next 2 weeks. And we're looking forward to doing a phase 2 in human intraoperative testing. Thank you very much for your attention. And if you have any questions, I'd be very happy to hear and answer them.